Hello and welcome to the Sweeney Show Business and Law podcast. Joining me today is Nick Charalambous of Alpha Wealth. Nick, if you'd like to introduce yourself and maybe tell us a bit about yourself.
So, I suppose, Dave, thanks very much for the opportunity this morning.
You're very welcome.
I have a financial services company based in Little Island.
Okay.
And I've given financial advice to individuals and business owners for the last, I suppose, 15 years.
Yeah.
I provide financial advice in many different areas, including insurances, and we have a subsidiary, Alpha Health, which provides specialised health insurance advice to the general public, just in terms of giving them advice around the different types of plans and that are available in the market.
Very good. And you're based here in Cork City, are you?
That's just outside in Little Island.
Excellent. So, health insurance is so topical at the moment. Bring it right back to a really simple question. Do we need health insurance?
I think the short answer is yes, Dave. The reason being is that you can't but pick up a newspaper and see that the state of the public health system is in disarray.
Yeah.
The number of people waiting on hospital beds.
Yeah.
And I suppose what the health insurance industry does is it provides an in into the private hospitals, which is really the mainstay of why people I suppose should avail of it. Okay.
And is health insurance expensive?
It is. I suppose, to put it in context, for a family of four, you are looking at the best part of about €2,000. Now, this is why I suppose advice is needed, because some people can end up spending over 5,000 if they're not careful.
Yeah.
And then on the other side of that, then people who pay too little for health insurance will find that they're not covered adequately for the cover that they need.
Okay. And then how do you know what cover suits you, or what is it or what age should you take out a policy at? Is it completely specific to the individual?
To a certain extent, I suppose the government introduced this lifetime community rating 3 years ago at this stage. And
sorry, what's that?
The lifetime community rating, it was basically a levy for anyone who's 34 years or older.
Okay.
So they effectively set an age of which they felt it was prudent for people to take out health insurance.
Okay.
So the general benchmark would be that anybody less than 34, not saying that they don't need it, but it wouldn't be as important.
Okay.
Whereas anyone who's 34 or over will actually end up paying more, certainly for a 10-year period, if they don't avail of health insurance at that stage.
Okay. And say if I want to take out a policy, but I have historic health issues, maybe I've just become sick in the last couple of years, and I've gone to my doctor, and now I want to take out insurance, so I don't know what's down the track. Is there obstacles to take out a policy for that, or what happens there?
So there's no health questionnaire when you take out health insurance, unlike most other types of insurances where you're loaded against anything that's obviously pre-existing.
Yeah.
The situation is that basically for the three different providers in the marketplace, which is Leia, VHI and Irish Life, who are effectively amalgamated into from one or two companies, essentially the way it works is that if you have any pre-existing condition, there's a 5-year waiting period. Okay, so it basically stops people who have just been diagnosed with an illness taking out health insurance and obviously availing of obviously the benefits.
Okay.
If you do take out health insurance, then you are, I suppose, not covered for the first 26 weeks for any new condition.
Okay.
So again, it's just to kind of, I suppose, prevent people who have, a notion that they may have something wrong with them.
Okay. So even if I had no underlying condition, once I take out a policy, I can't actually take a claim for 26
weeks. That's correct. Yeah.
Okay. So 6 months.
6 months, basically.
Okay. Wow. And so what's your advice? So at what age should someone take out a policy?
So I suppose, I went for years. I'm 44 years of age, Dave, and I have 3 kids. I went for years without health insurance because it became very expensive. And again, it's probably lack of knowledge on my part in terms of understanding what types of cover there is. So, for example, the main reason why I think people require health insurance is to basically get access to private hospitals, which I mentioned earlier. And really, for me, that's the most important thing. It's essentially, if something very serious happens, you don't want to end up with a bill of €10,000 and plus. The second reason is for, I suppose, maternity, which essentially covers both men and women, and it's fairly standard within most of the plans. And the third is for something called outpatients, which is claiming back for things like GP visits and so on. Now, personally speaking, I think that the latter of those, the outpatient benefits, it's a bit of a luxury, and I suppose some people are covered for that don't actually necessarily need it.
Okay.
So for example, I haven't been to a GP in over 5 years.
Yeah.
I personally don't feel that I benefit from that type of coverage. So my particular policy is relatively straightforward. It's basically good inpatient
so it's tailored
care.
For your needs.
It's tailored for my needs.
Yeah.
And this is the important thing, is that not one fits all.
Yeah.
So a lot of people historically would have had cover with VHI because they were the only provider for 20 years before the other new entrants came on board.
Okay.
And I suppose they've stuck with them, and for a lot of people they've stayed with some of the older plans, which are very expensive and probably not really fit for purpose.
Okay.
And this is where advice comes in.
Yeah.
Now the difficulty with, I suppose, the general public is that there's not too many independent health insurance advisors out there. To my knowledge, there's only one other, and they charge for advice. And what we've done is we've basically just installed Alpha Health as a free advisory service, whereby what we're trying to do is make sure people are aware of the different plans that are out there. There's over 450 plans available in the marketplace.
Okay. Is that a trick for the health insurance companies that they put so many options out there? If you say there's 450 plans, how can just your average person at home figure out which one is for them without someone like Alpha Health? Why is there 450 plans?
I suppose the health insurance providers would say that they're just offering new plans to tailor for each person's specific type of needs, and they have different types of, I suppose, benefits, encompassed with them.
Okay.
And to be fair, they would provide certain advice within the providers. So for example, Leia, VHI, Irish Life would have a customer service team that should be talking to the individual and making sure that it's fit for their needs. I suppose the biggest challenge for most people is the affordability.
Yeah.
Premiums have been going up, I suppose, consistently over the last 5 years, and they've risen by an average of about 15% per annum.
Okay. So what's driving that? The actual health provider service itself in the country?
It's the cost of, I suppose, getting the benefits, particularly with some of the hospitals.
Sorry, not to put under pressure, but is there a percentage of people in the country, of the general population, who should have health insurance and don't have it? What percentage of people are actually taking up health insurance?
So there's about 2.1 million people in Ireland that have health insurance. Okay, so I suppose the vast majority of those who are eligible for it, obviously.
Yeah.
In terms of, I suppose, the type of coverage, and this is where it comes back to, I suppose, being clever about taking out policies. So for example, I mentioned I have 3 children. I've never paid full premiums for those 3 kids because there are, I suppose, offers that you can avail of. And unfortunately for people, if they're not aware of these, and if their renewal dates don't fall into line with them, they won't generally get offered them. So, I think there's ways in which you can navigate the system. There are also things that people can do. For example, if you buy online, you typically get discounts of up to 10%, which again, for existing client, customers, they're not really told of. So it's just being properly advised. I mean,
you should do some research if you, as an individual. And should you get quotes of a number of companies, or?
It certainly doesn't.
Is it a plan that should be tailored to suit you?
Well, it doesn't hurt to shop around. I mean, I have some clients who they want to stay loyal to their previous provider because they feel that there are loyalty benefits. And unfortunately, that doesn't work with health insurance. I mean, I tell clients that there is no reason for them not to change. Moving from VHI to Leia or from Leia to Irish Life would not put them to any detriment, and it doesn't go against them. I suppose the key thing for themselves is that, is the policy the best for them, and is it the most cost effective? I mean, for example, I have some clients who are paying over €3,000 a year with VHI. I think that's absolutely extortionate. My own policy, which is with Leia, costs around €750 a year, and I believe that for anyone who's under the age of 50, it's enough, really.
And just if someone wanted to switch switch health insurance, is that a big process to do? Is there some constraint that if you switch a company, does that 26 weeks start again, or is there another constraint in whether if you had you want to take a claim on your insurance?
There's not. So, I mean, even if you were currently undergoing treatment for a medical condition and you change provider, that would carry across. There was no provision to prevent people from moving. It was made, I suppose, illegal, I suppose, from the government. But the key thing for people, Dave, is that they understand that, again, that if there is a pre-existing condition, they will be covered regardless of whether they stay with their existing provider or move. In terms of, I suppose, moving, the only caveat to that
so if I wanted to move and I didn't have a pre-existing condition but I felt there was better value somewhere else, is there a constraint that it can't?
Absolutely not.
If you had a new claim?
No.
Okay.
As long as you have a cover, and it provides within 13 weeks of the previous cover. So, you know, it is important that people do renew. The only condition is that they must do it on the renewal dates. Typically, you can't move from, say, layer to VHI if you're still within your mid-policy. The only thing you can do is to change plans within the actual renewal period.
And if I have an insurance policy and I have my children on it, what age do they come off it? Is there an opportunity, not an opportunity, but a space where they might hit a certain age, they come off the policy, I'm not aware of it, and then all of a sudden my child is uninsured and there might be a sickness? Is that something that can happen?
No, what can happen is that as children get older, because children's plans are generally a lot cheaper than they would be for adults. I mean, on average, a child up to the age of 18 costs around 250 euros a year versus another policy which can be about 1,000 euros a year or more. In terms of the thing to look out for is that when they do turn 18, and typically then the next cut off to age is 25 when they're considered to be a full adult, you can start paying excessive premiums. You know, you could end up with children who are in their late teens that are costing over 1,000 euros a year or more. So again, the thing to do is to obviously get advice and make sure that you're on the right type of policy for them and with the right provider. So for example, certain providers would be slightly more generous when it comes to teenagers and young adults than others. Personally speaking, Dave, I suppose for people who are based down in Cork, which is where we are, that my own advice would be definitely to look out for Leia. Leia have a stronghold here. They have their, I suppose, their headquarters in Little Island, and they would have slightly better contracts, in my opinion, with some of the Cork companies. For people who are in their later years, maybe particularly based in Dublin, then perhaps VHI might be better.
And if you're in a large organisation or your employer wanted to contribute to your health insurance, is that something that you can put in yourself, or is that something your employer has to go forward and put, maybe investigate or make a connection with a health provider?
So there's a lot of people who are covered through their company's health insurance policy, and I suppose they may have the notion that they're fine and that it's being paid for. A couple of things for them to watch out for is the fact that firstly, health insurance attracts benefit in kind. So whilst the company may be covering the cost of health insurance, the individual is still paying the...
You're taking it more as an income off the company in a benefit or in the guise of a health insurance.
They're typically paying 40% of the cost. So what I say to them is that, look, that's absolutely fine and absolutely do avail of the company's health insurance policy. But what you do need to do is be mindful of the fact that if there are choices within the plans, which there typically can be, don't just take the most expensive one because you think it's free, because you could end up spending a lot more. The other piece of that then is that people who have, say, spouses who are also being offered that, they sometimes need to make a choice as to which provider to go with. So for example, myself and my wife has a policy with a different provider than I do, and then I've taken the policy with my kids separately. So I suppose the provision for that is to make sure that we feel that we're getting the best value.
Interesting. And then what about something like elective surgery or an elective procedure? Is that covered under an insurance policy, or how does that work? So these policies are very black and white, and there's no greyness around them. So what I do say to people is, look, even if you have health insurance, it's worthwhile knowing what you are covered for, and they are very specific. And what we do is we basically give them a very simple kind of analysis of exactly what benefits there are within the plans that they have. For example, Dave, I mentioned earlier about outpatient benefits, claiming for things like GP, physio, dentistry and so on. Unfortunately, a lot of people, and again, many of us are kind of time poor at the moment, we're not claiming for things that we should be. And then there are people who, for example, may feel that, if they do have to go in for surgery and it's not covered, that they're hard done by. But it's just because it wasn't in the policy conditions, so they just need to be mindful of that. But I don't believe that there's any, I suppose, reason for companies to try and catch people out. Obviously, it's just a case of what is actually in the conditions. And just come back, you touched on it earlier, just about maternity cover. Is there a tiered policy that you can get, or is it that if you have you're covered for some kind of maternity cover that you have automatically private care inside in the hospital, or what is the I suppose the ideal cover for your maternity?
Yeah, so some of the plans do have slightly better benefits when it comes to maternity, but in general, Dave, most of the plans would typically automatically cover you for the standard, private hospital cover for the standard 3-day period. Again,
does that include then consultants through the course of your pregnancy, or is it just the care in the hospital?
It's just the care in the hospital,
right,
yes.
okay.
It's actually just at the time of birth, and then it can cover for things like home birth and so on and so forth. I suppose, again, the thing for people to be mindful of is that if they are particularly interested in that, firstly, the waiting period is actually a year, so they need to obviously...
so start your policy a year before
you look at actually obviously trying to...
Okay, so a bit of planning involved.
A bit of future planning involved.
Yeah.
And the other thing then is obviously if that is something that's particularly important to them, it's more important that they do get specialised advice, because it's not a case of that it's one fits all.
Great. Is that something you do in Alpha Health?
Absolutely. So again, our main day is this, in that we're trying to kind of, I suppose, get out to meet more people, and one of the ways which we feel that we can add value is by giving people advice on health insurance, and it's a very simple thing to do. So I have colleagues working for me who have previously come from the likes of VHI and Leia, and once you know what you're doing, it can be relatively straightforward to direct people in the right way.
Okay.
As I say.
Well, Nick, I think we've covered a lot here today. Thank you very much for your time. If people want to contact Nick and his company, we're going to put the details up on the screen here. And Nick, thank you very much.
Thanks very much.
Thank you.
Thank you.